My name is Casey Hunt from Region 18, and this is my presentation on dysphagia and tracheostomies. Dysphagia is a swallowing disorder caused by issues with the oral cavity, the pharynx, the esophagus, and the gastroesophageal junction. Here's a picture just to show the swallowing process, the direction of how the bolus should flow, and all of the structures involved in swallowing. A tracheostomy is necessary when the trachea is blocked or a patient cannot breathe on their own. The tracheostomy tube is placed in a hole that's made on the anterior part of the neck and the trachea, and a tube is placed there to allow the patient to breathe or to be connected to a vent if necessary. Tracheostomies can be temporary or they can be permanent, and the actual term for the procedure is a tracheotomy. Here's some pictures of the trachea and where the incision is made. All the pictures that I saw, the tracheostomy is placed below the vocal cord, so it's in the trachea. This is what the trach tube looks like. It's just a couple inches long. The patient breathes in, breath can go out. It's anchored to their neck so it doesn't move. So during my studies for this, I decided to research the topic, do tracheostomies cause dysphagia or aspiration? And all of the studies that I found, they all started with, there's an assumption that tracheostomies or the removal of tracheostomies causes dysphagia or aspiration. But all of their studies concluded that tracheostomies are not the sole cause of aspiration or dysphagia. Dysphagia or aspiration is most likely a comorbidity of other illnesses, diseases, or injuries. And here's the studies that I did and their findings. The first one was tracheostomy and dysphagia, true, and unrelated. Swallowing disorders in trauma patients, the impact of tracheostomy, and does removal of tracheostomy affect dysphagia? So in this first study, 88% of the subjects that did not aspirate pre-trach did not aspirate afterwards. So if they were not showing signs of dysphagia or aspiration before the trach was placed, they did not have any aspiration when it was removed. All of the patients who did aspirate before the trach placement aspirated after the removal, and their study concluded that severe medical comorbidities caused aspiration, not the tracheostomies. The next study was swallowing disorders in trauma patients, impact of tracheostomy. So in this whole study, there were 224 patients. 102 of those were trauma. The remaining 122 were not trauma. And of those two groups, half of each group had tracheostomies and half did not. After conducting bedside swallow studies and video fluoroscopies were completed, the study concluded that tracheostomies were not associated with increased dysphagia or aspiration. And then the last study was, does removal of tracheostomy affect dysphagia? There were 13 patients in this study, but they all had to have the following criteria. They had to have a tracheostomy, they had to tolerate their tube plugging for 48 hours, and they had to expectorate without assistance. All the patients had 2 video fluoroscope swallow studies, one before and one after. 0 patients showed changes in swallowing function between the 2 studies, so they also concluded that there's no relationship between tracheostomy tube placement and dysphagia. So in conclusion, dysphagia and aspiration are not solely caused by tracheostomies. The comorbidities, other illnesses, or other injuries cause dysphagia or aspiration before or after the tracheostomy.